during winter break ke baad, you see a lot of kids when they go back to school, they do fall ill, and there are a rising case of flu cases. And we did mention we'll have an expert to talk to us about that. We have consultant pediatrics and pediatric pulmonology expert from Medcare Algeciras, Dr. Amar El Zawahry. Good morning, Dr. Amar. A
Good
pleasure.
morning. Yes, good morning. How are you?
Excellent, Dr. Amar. And
Yes.
yesterday, when I went to my son's school clinic, it was house full. It was packed. And I asked the nurse there. She said,
Yeah.
this has been the case for a week. So it's not
Yes.
surprising that the flu cases are very common among kids now.
Yes. See, nowadays the clinic is full of respiratory illness, especially now with flu. Is what's called this virus infection, and it's different between flu and common cold. It is flu now is common by virus. It's virus A, influenza, and the virus B, which is common now since now maybe it is not only this week, maybe two months back, and they start to increase more and more. Symptoms for flu is different than, as I told you, is common cold with coughing and start with running nose, cough, low-grade fever. But with influenza, the fever is prolonged and in high, which is to 40 degree and sometimes more than 40, which is screaming for or scaring the family itself. And associated with the headache, chills, rigors, and in children is coming even with abdominal pain, diarrhea, and even vomiting. The risk of infection in children that is very spreading and very fast, especially it's the most contagious disease in school nowadays. The problem is in school is baby is coughing or child is coughing or sneezing in front of each face together. So that's why we recommended that I would instruct the child that when is coughing or sneezing, please with tissue or put it hand or even elbow is better for that. Infection is spreading more even with touches the surface itself. That's why cleaning the instrument or surface in school is recommended a lot. There is other for treatment for this one, and even instruct the family, please, when the baby is having fever or a child having fever, please don't let's go to school because it's spreading more with school. I know some of family is working, but we have to keep the baby in or child in the home. At least fever will go 24 hours. Symptoms is increasing more with the child with less immunity or asthma or chronic lung disease. But that's why we need to instruct or insult the doctor in the clinic. Maybe the infection is need itself the hospitalization. By the way, treatment of flu is usually good rest, good nutrition, improve immunity, and bed rest is the most important. Treatment with antiviral like Tamiflu is the best at during the first 2 days of starting the disease itself. And as you know, infectious of our contagious, it will start 1 day before the symptoms and continue till the symptoms disappear. So that's why keeping at home is the most important. Giving antivirus, as I told you, it should be the first 2 days. But sometimes we need even after first 2 days to continue with antivirus because it's important for some children who is having asthma or chronic lung disease or immune deficiency to continue. And the antiviral is not only to protect, also to treat and this, keeping the baby or the child with short stay more than the prolonged of infection to be completed like 7 days or 8 days and prevent even a complication like pneumonia or bronchitis, some having what's called reactive arthropathies or myalgia. So that's why recommendation also for vaccination, which I'm repeated for the family to take flu vaccine, especially with the months of September and October. And even this vaccine, we can take it later, not important only starting with the season, September or October, even after that. And from vaccine will be from 6 months onward, and the baby less than or child less than 9 years, you have to take two doses with 1 month apart. This is my recommendation for all family, please.
Right.
Flu vaccine is most important, and we have to take it with start season.
Right.
So, Dr. Amir, when do you see that, the flu season, when it ends? I mean, from every child, it is case to case, but how many days does it take for the flu to get out of the system of the body of the child?
Usually it will be in children 5 to 7 days, and doing complete antiviral for 5 days usually.
Wonderful, Dr. Amir. Thank you
Right.
so much for sharing your insights.
Right. But also, when it comes to vaccines, you did mention that it is recommended. We don't mind, but the kids are so scared of the
Yeah.
injections, doctor. What can we do for that?
You can explain to them in nice way because it's easy for them. So I know they are running, screaming,
Yes,
but there is
yes.
way to
Yeah.
explain to them. And mashallah, nowadays our children is like adult before. They understand everything.
Yes, doctor.
iPad, the iPhone, the screen, just all they understand everything. And sometimes the baby is coming to me and they, doctor, give me the shot. They ask by themselves.
Oh, nice.
Mashallah, yani.
Yeah. But a lot of, knowledge that the kids gain, that they are aware and they know and they understand better. There are some,
Yes.
trends which they actually start following, looking at social media. What would you like to tell them, doctor?
See, there is some family they keep iPhone or a screen itself. By the way, you open very most important subject, which I'm telling the family that please let the baby or child away from screen at least the first 2 years of life,
Okay.
because it can causes a lot of problem after that. Which is, I'm saying that the baby is coming to me or child coming to me with 3 years old and even not looking to me because he's having the iPad, and which is the dangerous for the behavior, the communication of a child. But that's why many mothers coming and say, doctor, my child now there is delayed speech. He's not respond to me. It's because of screen time. That's why after, and usually before 5 years, as we can let them not going to watching TV a lot, not to making that screen time more than, even if I will tell you 1 hour per day is the maximum before 5 years. Before 2 years is forbidden. We cannot even for 5 or 10 minutes.
So, Dr. Amir, what is your recommendation to children and especially kids who are, in their young times to keep away from flu? What are your recommendations in terms of their healthy eating habits?
The most important now in school, the cleaning hand, good rest, good nutrition, flu vaccine itself, instruction for that child in between each other in the school. When you sneeze or cough, as I told you before, we have to put tissue or at least rest, because if handy will be transferred. And you know that virus itself can live in the surface, but it's short time, by the way. For cleaning and sterilization in the school is very important for that. We'll tell them family, when the baby or child having fever, please keep at home. As I told you in the first of our conversation, please mother, when the baby having or child having fever, keep at home. Don't let him go to school, please, because it's transferred, because the virus is very contagious, very, very contagious.
Great. Dr. Amar, thank you so much for sharing the valuable information with everyone. And I'm sure that, we are in a better position to take care of ourselves. And
Yes.
in case of anything, we can always visit you at Medcare, I'll guess.
Yes, Medcare Royal Hospital. I'm Dr. Amr. Thank you very much.
थैंक यू। सुनते रहिए टॉक 100.3। कमिंग अप टॉक बिजनेस, और उसके बाद क्या खूब लगती हो। तारीफ नहीं कर रहा मैं, गाने का नाम
मेरे को
बता।
मालूम है।
हाँ।
Welcome to Deva's World, where